I'll tell them, hey, I think your best bet is find a doctor that when you look at their work, it represents exactly what you want. If you look at my cases and you don't see, a majority of the things on there that you love, it probably isn't the best fit, because that's kind of more my specialty and my look. So I try to be super transparent with patients about the aesthetic and what they're looking for.
Hey guys, welcome back to another episode of the Digital Dentistry Decoded podcast. Dr. Ahmed here from IDD, keeping you in the know of all things digital dentistry. We have a special guest today. We are moving away from the CEOs and CFOs and the tech giants and all of that in dentistry to speak to an amazing dentist in Phoenix, Arizona. So we have today Dr. Brian Harris. Welcome, Brian.
Hey, it's great to be here, and it's an honor to be with you. Everybody I know that's important, I feel like, keeps bringing your name up in one way or another, and so I felt like it was a good opportunity for us to get together and to chat. So,
thank you so much for the kind words, guys. Look, it's impossible to know every dentist out there, but Dr. Brian does incredible stuff. If you haven't checked out his Instagram, go there. Dr. Brian Harris, over 333,000 followers. He does amazing stuff with cosmetic dentistry. And why I wanted to bring him in is he's really deep into digital. And also, let's face it, cosmetic dentistry is the biggest topic in dentistry. I mean, it always has been, always will be. I can remember being a dental student, always wanting to get into it. I haven't quite mastered it like Dr. Brian, but this is why he's here. Now, before we jump into all of that, Dr. Brian, now talk to me about your history, about your past. We had a bit of a chat. I think you come from a dentist family. Just a little bit, where you came from, how you got into this kind of field that so many people want to get into.
Yeah, absolutely. So my backstory, I grew up around dentistry. My dad was a dentist, and so I would work for him every summer. And in the early 90s, I saw him go through this radical transformation personally. He went to the first ever live patient hands-on cosmetic course. It was at the Baylor Aesthetic Continuum at that time. He was there. He roomed with Howard Fran of Dentaltown, and he was at that course with Bill Dickerson, Bill Dorfman, and David Hornbrook, and really all the greats of cosmetic dentistry, and came home from that just an absolutely changed man, and transformed his practice, started doing a lot of cosmetic dentistry. A lot of those guys went on to form what was then called LVI. And my dad was one of the original founders of that, and then transitioned over to Pac Live and taught cosmetic dentistry for a number of years. And so I, as a teenager in high school, seeing him go through that transformation, that was the first time that I was like, I think I want to be a dentist. And the rest is history. My older brother felt the same thing, seeing him go through that. So my brother went to University of the Pacific, and 2 years later, I followed him, and 2 years after me, my younger brother followed, and my youngest brother opened a dental lab. So that's my dental story, and I've been in practice about 22 years, and have been fortunate to do some pretty awesome things within the dental space, and feel super grateful for that.
That's an incredible story, man. It's funny how you hear that in the dental industry. The apple really doesn't fall far from the tree, obviously. I've spoken about my story with you, and my dad's a dentist, and I was super inspired by him. And one thing that resonates with me, though, rather than just talk about our families, is that how important a good mentor is, especially for younger dentists. I imagine your dad was an incredible mentor for you. My dad was an incredible mentor for me, especially post-dentistry, post your degree. And, for people trying to wrangle these complex parts of dentistry, that's always my advice. Find a great mentor. It changes your career completely. But let's talk about cosmetic dentistry, because you do quite a lot. You're involved with Neer, which is this new initiative for 3D printed veneers. You're involved with like a injectable, I think it's a lips thing. You're involved heavily. You do a ton of cosmetic dentistry on your Instagram, and it looks amazing. How do you wrangle all that? How do you get into all of these things? And also, in your reflection over the past, let's say, 20 years of practice, what's some of the key learnings that you can share with us?
Yeah, so I would say, so right now I do cosmetic dentistry. I only do porcelain veneers and now, the new 3D printed hybrid products. I'm, really bullish on. I think they have massive potential in the dental space to kind of create this mid-tier product. And I think there's a lot of excitement around that. It's just going to keep getting better. And so that's the only thing I do in my practice. It's smiles, and it's either, I would say probably 85 to 90% still porcelain, and then that 10 to 15% hybrid. And I love it. I think that cosmetic dentistry is so much more about good communication than anything else. And so as I look back, I mean, the reason I got into it the way I did was really because of social media. I've always done a lot of cosmetic dentistry, but when social media first hit, like in 2016, 2017, I started just posting my cases. And it was the first time ever that I was able to show the world what I could do. And it felt vulnerable because, as dentists, we can be a little bit judgmental of each other's work. And so, initially I was like, what are all the dentists going to think? And then when I got out of my own way and realized, like, you know what? It's not about what the other dentists are going to think. It's about all of these people out there self-conscious of their smile and doing nothing. And then I tried to just always focus on that and post for them. And the rest is history. It's been pretty amazing to see it grow and to continue to be able to help people from all over the world.
I tip my hat off to you, man. I was later than you at social media. I think I only really got into it in the past 5 years because, again, it's that takes guts to put yourself out there on social media, especially, I imagine, all the little squabbles that you would have experienced and all the people trying to tear you down, etc. And so it's incredible what you've done and what you've built. For a lot of those dentists out there who are listening and they want to get into cosmetic dentistry, I mean, we talked about it. We'll jump into it soon about the patient process, not just the kind of theory of cosmetic dentistry. I really want to jump into your techniques pre-consult, during treatment, post-consult. But, for those thinking they want to get into cosmetic dentistry, and a lot of dentists do, what's your advice to them? If you could give advice to Brian Harris 20 years ago, you had a pretty good run. What would be your advice to really get into this field?
Yeah, I think within dentistry, you're going to have the most success with the things that you really, really enjoy doing. So if you want to get into cosmetics, I would say do it because you absolutely love it. You love the patient communication side of things. You love the creative side of things. Do it because you love it, not because of the financial gain. And I think it's the same thing for, clear liners or all on four procedures. There's things that I used to do in dentistry that I started doing more because they were profitable for the practice. And I really did not enjoy doing them. And that never goes well. And I don't think it's fair to our patients either, that we're doing procedures that we don't love doing. I would say find the thing that you feel like you're good at and that you really love, and then just go all in on that. And if it's cosmetic dentistry, great. Find a good mentor. Like you said, I think the key with the mentor is, not necessarily like go to a good course. No, find a good mentor that you can reach out to and say, hey, I have my first case. I don't know what I'm doing. Like, tell me exactly how to prep this so it goes successful.
Yeah, for sure, man. I honestly think that your first job is pretty critical in that, because typically your best mentor will be in the practice. I mean, I know online there's a lot of groups and a lot of people selling mentorship, but I think nothing beats someone like work with someone who you're inspired and can really be there for you. And I think that's really what accelerates you, especially for younger grads, etc. So let's talk about cosmetic dentistry. One thing that comes to the top of my mind is you talk about porcelain, right? And I'm sure the first thing people wonder, because you know what dentists are like, is what are you using, which materials, which products, etc. So porcelain, are you using Emax, are you using zirconia, is it a mix? What are we dealing with here?
Yeah, I've got a lot more gray in my beard than you do. So like I'm still old school from the standpoint of like, for me, it's mostly Emax. And if it's not Emax, it's zirconia. I love Ivoclar's products. So it's Emax and it's Zircad Prime. And I would say the most common shade color. I do a ton of BL2, medium translucency or high translucency. A lot of my cases kind of lean more towards the bright, less natural side of things. And that's kind of really my specialty. And I know it seems kind of weird to say it that way, but I think it's important the dentists understand that the patients are going to be attracted to your work based on what it looks like. And so I don't have a ton of patients reaching out to me to do supernatural, lots of translucency, natural colors, because I don't post a lot of those cases. And if somebody reaches out and they really, really want something natural, and I'll tell them, hey, I think your best bet is find a doctor that when you look at their work, it represents exactly what you want. If you look at my cases and you don't see, a majority of the things on there that you love, it probably isn't the best fit, because that's kind of more my specialty and my look. So I try to be super transparent with patients about the aesthetic and what they're looking for. We can create anything, but most of our stuff falls into that category: Emax, zirconia, and then 3D printed.
Resins are amazing. And cements, I assume, obviously the Ivoclar products, I assume Verilink aesthetic, etc.
Yeah, I love Verilink aesthetic. I really love 3M Reliax veneer cement, light cure, because of its properties and because of the color of the cements. But I mean, those are kind of my top two. If I'm doing a dual cure, I'm a huge fan of all Kerr products. So I love NX3. I think it's a great product. For zirconia, I'm using Bisco's product. Oh man,
It's okay.
I know this is terrible. It's the Theracem. I'm sorry.
No problem.
It's Theracem.
Man, I don't expect you to know every single freaking thing in your drawer. I totally get it.
No. It's just the Bisco rep's going to watch this and be like, Harris, like you had one chance to talk about the product that you use and you dropped the ball. But yeah, Theracem is what it is. It's awesome.
Nice. And look, we're not going to get into burrs and prepping. You guys need to learn that. That is not something you can learn off a podcast. Scanners. You're obviously very heavily involved in digital, probably as much as me. And we'll talk about your process and pre-consult. But I'm curious. Don't want to put any company on the spot here, but which scanner do you use in your practice?
Yeah, so I was a CEREC trainer for about 10 years. And so we've always had CEREC. We've got a couple prime scans in the office now. I love my Atero. I use that for a lot of cases. I also have an Ori scanner too,
Nice.
which is a newer company on the market. They're doing some cool things with monthly payment options for leasing scanners. And I love that thing too. So, I mean, I kind of use different scanners for different process, but I would say the workhorse is the Itero, and then the Ori for, just the basic stuff.
I'm a big fan of the Lumina, especially. I think it's a bit of a sleeper. I think Itero has gotten a lot of flack over the past 10 years for being the Invisalign scanner, but they're definitely trying to rebrand themselves there, and they're pushing and doing some amazing stuff. But okay, scanners aside, let's get into cosmetic dentistry. Talk to me, Dr. Brian. The whole process, we talked about this off camera a bit, and I think, a lot of people get involved and talk a lot about, the DSD process and working with the lab and getting a mock-up and transferring that. And I think most of us get that by now. We will still touch on that, but let's actually take a few steps back. You brought up something that was really interesting. You said this will be a cool topic to talk about, and you're right. The pre-consultation process and how many tools now we have in dentistry with all this AI. I mean, you guys all see it on your Instagram reels. There's AI slop everywhere. AI can make all these videos that these days when you're watching a video, you check the comments and people are like, is this AI? It's so hard to tell now. And so we are using these tools now to qualify patients, and there's smile design tools. But you talk to me about your process, how you see all of this kind of panning out for cosmetic dentistry.
Yeah, I see digital very differently. So my digital workflow, I call my digital workflow probably something different than what you call yours. And you're right. I think the whole digital design, the DSD process, I think all that's fantastic. If I'm being totally truthful with you, I don't even know how to design digitally. I've never used exocad. I don't follow that type of digital workflow. Mine's a little bit different. I start every case a patient has to go through a video consult with me before they ever come in and meet with me in person. And that's not even a live conversation like this back and forth. It's a simple call to action on every single Instagram post. It's on my website. It's everywhere. And it's just like, hey, are you self-conscious of your smile? Upload a smile photo. Tell me what you want to change. And I'll send you back a video with my recommendations, options, and a full cost breakdown. And so the barrier to entry to get access to me, I make it extremely low. And also I'm very selfish with my time, where I'm not going to give somebody 45 minutes of a live back and forth asking questions. I'll give everybody 5 minutes of my time pre-recorded as an expert, telling them exactly what I think they should do. And so that's where Smile Virtual was born. It's a software company that I created years ago. And there's, I think 500 dentists using the platform now across the world. And that whole platform is designed so that patients quickly upload a photo, tell you what they want to change, and then you record a customized presentation video, send it back. And so by the time they actually come in and meet with you in the practice, they already know your fees, they know who you are, they know the recommendations. So we're like at a 92% case acceptance rate on everything over $15,000, because I won't spend an hour with somebody if they don't have all that information first.
That's really smart. Basically, like sifting through all the weak leads to get to the hot leads that are really interested,
and still serving all of them.
Really?
You know what I mean? So I think that's the thing, is it still allows me to serve anybody who's interested. Like, I'll give you a little bit of my time, and I would say from people reaching out to actual in-person consult, there's only about 40% of those that request a virtual consult that they come in for the in-person consult. But it's still 60% of those people that I've been able to help, and they know who I am. They know the kind of work I do. So when they are ready, hopefully the trust is there and they'll come back. And so that's how, when people say, well, how are you booked out 4 or 5 months in advance and you only do big smile cases? Well, because I just get in front of a lot more people. I just do it differently in way less time.
I think that's a trick, eh? Like, a lot of people, whether it's all on X or cosmetic cases, people can do these cases, but I think it's doing them consistently over the year and always being booked out and always feeding that funnel at the top end to have this trickle down of patients is the hardest part. And it sounds like you found a way to constantly feed that engine with new leads. I imagine you get hundreds of these a month, or maybe thousands. Do you just sit down one day and smash them all out, or how does this work?
Yeah, so realistically, I get on average about, as far as virtual consults through Smile Virtual, probably about 45 to 50 a month. And I just have it. So every day when I show up to the office, I try to get at least, 2 or 3 done on the days that I'm seeing patients. And it's always something I do. Every morning when I first get here, I get in the right mindset and I say, okay, if I'm going to give them my time, I want to give them my best 5 minutes, and then I'll record a few, send them off. And then it's a whole built-in funnel to where when they're interested, then they'll reach out to my team. The thing about Smile Virtual over the years, the number one issue though has always been doctors that actually start to use it, they just want to get more leads. And so, this last few months launched a product that is like the ultimate lead generator for cosmetic leads that then you can dump into virtual consults with Smile Virtual. So it's just understanding how to get people's attention, and the whole game of marketing has changed now. All the game now is just a matter of like people raising their hand and saying, hey, I'm interested. And as long as you can recognize who those people are, then you can take them through your process.
And you'd agree that in the game of marketing these days, it's basically almost critical to be on social media. I mean, a lot of people will be on the fence. A lot of people still don't post. There's those barriers. They don't want to put themselves out there. Would you say for anyone who wants to be having this huge patient flow, you have to put yourself out there? You have to have a social media presence. Is that a fair assumption?
I think it's fair. I think how you go about that is going to be different for everybody. I don't record a lot of videos of me talking. I don't record a lot of personal stuff on my page. It's not a page. It's all about me. I do smiles I highlight my patients, and then I'll do some business inspirational stuff, some personal stuff with my family. But I think if you even kept it really simple and posted once or twice a week, and only posted things that you felt would be beneficial for your patients, I think that's enough. It's just a matter of giving people what they want to know.
I have to say, it's a lot harder these days. There's so many people trying to do it compared to 10 years ago. Not to take
Oh
from
yeah.
your amazing success at all. I'm not saying it was easy for you either, but you could see it. A lot of people these days can post some incredible work, and it's just not what it used to be with the growth. And there's such a saturation of people trying to do this, and now with the AI slot. But you have to do it. What are
For
you going to do?
No, you're right. And I'll be the first to admit, like, to grow in the early days of social media, yeah, I mean, we could do a simple $1,000 off a smile makeover giveaway strategy, and you could grow 5, 6,000 followers in a week. I mean, it was so different in the early days. And that's why my follower count, honestly, for the last, I would say 5 years, it slowly grows and then it slowly drops off. So I've been in that 330 to 340 range for probably 5 years. It's not, I mean, I'm always gaining followers, but I'm slowly losing them too. So it's not the same to grow now as it used to be.
Which, look, to be honest, 330 or whatever it is, 300,000 plus, look, congratulations, man. Let's not take away from that. That's massive. I mean, you must be one of the bigger cosmetic dentists out there. I know there's guys with millions. I know the alphas, etc. But this is pretty elite level following here. And you can see you've done it in a way that just benefits your business. You're not posting your cars or whatever. You're just focusing on basically lead generation and feeding that into your business. Let's jump back to cosmetic dentistry rather than social media. Okay, so I'm a patient. I do this thing. I take a photo of my teeth. I send it to you. I'm really keen. I come in. I book a call with your team. I come in and meet Dr. Brian. For people out there that are trying to figure out how to frame these cosmetic dentistry appointments, there's a lot of talk out there of what you should be doing. The scanner companies are saying, scan every patient, do your smile designs, etc. It helps sell cases. Align has a whole bunch of different amazing software suites, from the ortho simulator, the cosmetics, the smile architect, etc. What do you do? What I know everyone's different, and we don't want like a blueprint and everyone wants to do exactly what you are, but I think a lot of people actually have no idea how to frame their consultation appointments, what to do next, how to close, etc.
I'll share what I do, and I know it's not going to be what most people want to do, but then I'll share an alternative that I also think works really, really well. So you got to remember, when people come to see me for that in-person consult, they already have most of the information. And so just the fact that they're there lets me know, like, they're interested in moving forward. Now it's just a matter of finalizing the details. And so realistically, I spend about 5 minutes talking with them, asking questions, getting to know them. And they know that part of the in-person consult with me, they get 1 hour uninterrupted time, and they're going to leave that day with a new smile in place in temporary form to wear for the day. And I show them how to take it off at night. And so I still do all of my smile test drives, is what I call it. I do it with flowable composite and some burrs and some discs. I freehand all of my mock-ups. It's how I make my temporaries. I don't do a lot of wax ups. Everything's freehand. So it's not as practical for most, but the idea is that I want everybody leaving my office that first visit with the ability to smile with confidence and to wear it around and show their friends and family, and then decide if it's something they want to do. And so the alternative to that is with Neer. If you're a doctor that doesn't like to do like a freehand mock-up, you take a quick scan, you send it to Neer. They'll send you back the Moment product, which is basically the 3D printed overlay that the patient can wear and wear at home and experience that new smile. Now, it means another visit. They got to come back to get it delivered. The Neer product, though, for a Moment is like $100 to have one made. So the cost is very inexpensive, and you don't need to know how to design. You don't have to have a printer. You don't have to have those things. So I would say freehand it, Or if you have a printer, print it, let them see it, or just order it from Neer. But I think everybody needs to feel the emotion of confidence to feel 100% comfortable moving forward. And last thing I'll say is I don't believe in taking an impression, sending it out, doing a wax up, then doing the overlay, seating it, going through all that, purely because it's a lot more expensive if you're not doing it yourself. And now it's multiple visits. You're having a trim in the mouth. It's just a lot more work when there's easier ways to do it nowadays.
100%. I think digital has helped a lot. Look, you would be the number one person who understands this best is how much it's changed. Before, just to get us a wax up, I think probably that's why you've honed your skills to do it in mouth directly. I mean, not a lot of people can do that. I'll put my hand up and say, there's no way in hell that I can do that. I can design it smart, I can print it. I don't have the skills like you to do it directly in the mouth. But I imagine that's from necessity, because before all this digital stuff, like you say, getting a wax up, and a lab may charge you $5 a tooth or $20 a tooth. That's a lot of money before you even got someone signed in, even though you may know that they're already in the door.
Yeah, they were at one point it was $40 per tooth, and it was like 2.5 weeks to get it back. And so I'm like, wait, okay, it's $400. Who's paying that? Is the patient? I don't want to ask them to pay $400 to see what their smile could look like. So there was all these barriers, and yeah, out of necessity, I'm like, well, I'm just going to learn how to do this freehand. But I look at some of the digital designs now. I would love to say that I've got great hand skills and I can do amazing mock-ups, but it doesn't touch like what some of the printers are doing now. It's pretty remarkable what we can do in such a short time.
Totally is. And it should give a lot of confidence to those guys that are trying to get into digital, because Brian, you would know the plan or the wax up is kind of your blueprint. That is the key. As long as you can prep half well and you know some principles about thickness and where you should hide the margins, that's really the key. And these days, like you say, with digital making the wax up so easy, and you don't even have to do it yourself. Look, it's not easy for a dentist to do it chairside. We're busy enough. We have a lab in-house personally. I'm sure you do too. But for those who don't have a lab, there's so many good designers out there that will do a wax up for you, and they look freaking amazing. And once you have that STL file of the wax up, that's your blueprint. You can go and get that printed, try it in the mouth, check if it looks good, and then if it looks good in the mouth, just prep the teeth and you're off. I am curious. So when you do this kind of smile test drive, are you doing this every single patient without question, even if they're a hot lead, even if they sit on your chair and they say, look, I'm keen, just cut my teeth? You will do it as a routine, or is it more like to get people from the warm lead to the sold?
I would say I do it probably 80% of the time. I do it. The only time I don't is if I can tell somebody's in a hurry, or I can tell it's a certain type of personality, and they're like, listen, I don't need to see it. I'm ready to go. Like, let's go. Like those, I'm not going to put them through it because it takes about 40 minutes to do it. The other time that I don't do it is if the teeth are already too big or flared, or, if the teeth are crooked, we'll uncross them with the mock-up all the time just to kind of trick the eye. The value in doing it is that, and let me back up. When I do it, I tell all of my patients, I think this is really important for everybody listening. If you're going to print a mock-up, or you're going to do it in freehand, or even when you're showing patients temporaries for the first time, I never try to make that experience like a reveal and look how amazing it looks, because it's a lot for the patient to go through. And if you've ever had your smile done yourself, you know that I have veneers on my own teeth. Even when you're looking at something and it should look good, when you look at yourself and it's different, it's kind of a lot to take in. And so I don't ever want my patients to feel like they have to be forced to liking something. I always tell them, hey, listen, I'm going to give you a mirror, and this is not so you can see, oh, look how amazing it looks. It looks good. There's still several things that I would change about it, but this is a communication tool so we can see what you like, see what you don't like, so that when we actually go and make the temporaries, that we're much closer to ideal. So look at it, take it in, and then let's talk about all the changes that we want to make. So I'll specifically then go in and point out all the little things that are wrong with it, so they understand like, oh yeah, it's going to be much better than this. Does that make sense?
Yeah, that's epic, man. I love these pearls of wisdom. I mean, you could tell this comes from years of just trial and error and refining your craft. So I appreciate it. I'm curious as well. Like a lot of dentists will be thinking, "Am I doing this for free? Am I not?" I assume you just bake this into your consultation cost, and it's just part of it, right? You're not charging for these mock-ups that you do direct.
Yeah, I bake it in, and because I know, again, I know they've already seen the video, they know the fees, I know they're ready to move forward. I'll take a risk on those people. What I used to do before I would do the virtual consults, like I wouldn't want to make that kind of a time investment or money investment to have something made because I knew that they had no idea what things were going to cost. And it was common to get to the end of a consult and present the fees, and then it's 2 to 3 times more than what they thought it was. So I think, yeah, I don't want to spend all this extra time doing that when they're not prepared. So if you can prepare your patients before they come in, yeah, then I think you should do it either for free. I charge a $99 fee. You get me for an hour for $99, and that's not for anything other than making sure that when they schedule that I know they're serious and that they're willing to show up and pay something to be there. So I think charge something, unless you're getting started and you're really slow and you have the time, then I would say do it for free. You got nothing to lose, and it's a good learning experience the more repetitions you get.
Especially in this climate, man. I don't know if you guys are feeling in the US, but we're certainly feeling it over here in APAC. Books are not what they used to be. I think a lot of people that are super successful like you, they can keep the engine going. But look, if you have relatively sparse books, there's no shame in doing a couple of things for free and get going. Do something. Try hone your communication skills, etc. And going back to the wax up thing, and of course these days we have amazing services that didn't exist before, like Neer. I saw Neer at Chicago Midwinter. I think they did their launch. Fascinating concept there, and really curious to see how that goes. For those who don't know, go to neer.com. Essentially, scan a patient, they will do the design, and they'll 3D print you the mock-up, and it's all yours. And they will even do that as a final if you want to use 3D printed finals. So it's a really interesting concept, and it's incredible now with digital, all the different services that are coming up. A lot of things that you probably think back 10 years ago, you're like, man, I wish I had these things. Even as the basic things like scanners now.
Yeah, what's interesting about Neer and the whole 3D printed process is, I tried some 3D printed cases a couple years ago as like a final restoration for my patients that maybe couldn't afford porcelain, and they looked terrible. They were opaque. It was like I could never pull it off. But when the new the Crown HT materials came out, that was a big shift, both in, quality of porcelain and that 65% porcelain fill, but also the luminescence of the material. SprintRay wanted me to test it out for like these smile test drives, and they printed individual units for me with the Midas, and I went to try them in for the test drive, and I'm like, damn, these actually look really good. I'm like, I think you could absolutely use this as a final restorative material for the right types of cases. And I've got about 25 cases now, 10-unit cases that are printed, smile cases with a printed resin hybrid. And the longest one I have out there is probably about 14 months with the new Crown HT material. And I mean, it's working. My patients love it. The way I present it to them is, if you want a new smile, you want more of a drastic change, and you're really wanting to have porcelain veneers done, but you're just not at a point in your life where you're ready to make that kind of investment, this is a great alternative at half the cost. And so that's how I present it now. You have 3 ways to transform your smile with me. We can do smile shape, which is essentially enamelplasty, gingivectomy, and whitening, taking their own natural teeth, making the best we can make it look. You can do smile sculpt, which is a 3D printed process, or Neer, or you can do smile design with porcelain. And I think especially as things are slowing down for people, having 3 tiers for people to choose from it's super important, in my opinion.
Totally agree. I totally agree. And I think that's where 3D printing is finding its ground, especially in the cosmetic space. I mean, obviously there was a lot of noise at the start, and they were going right up head against Emax and zirconias, but this is also what I'm hearing. It's just a really good middle ground option that you can offer for these patients that you may otherwise would have never provided a service for. So rather than just say it's either all in 15K for porcelain or nothing, why not have that middle ground option if you can pull it off? What's your thoughts on the longevity? I mean, a lot of people, this is their concern with 3D printed veneers, especially if they're not prepless and you've done a bit of preparation, even if it's light. What do you tell the patients? Are these lasting, in your mind, 5 years and you have to replace them again, or 10 years, or what's kind of that dialogue that you're having?
I try to always do these cases no prep or very minimal prep in simple areas. And the way I talk to my patients about it is I intentionally have my fees set at half of the cost of porcelain. And I tell them that it's because that I expect these to last half as long. And with my porcelain cases, I would love to see things last 15 years, 20 years would be great. With these cases, we're looking more like 7 years longevity. And we don't know. It's still a relatively new material, but from what we're seeing so far, it's very promising. Now, I also will tell them, because it is a newer material, if something comes up along the way, and let's say we get a couple years out and we realize they've lost their luster and we need to shine things up, come in, we'll take care of that. That's all part of the process. Or if something chips or breaks, we'll jump right in, we'll fix it. And if we need to decide down the road that it's time to switch to porcelain, then we'll come up with a fair way to upgrade you to porcelain, and you can pay the difference in cost. I try to just handle it in the fairest way possible and just treat people like I'd want to be treated,
Yeah, that's epic, man. I really love how you do that positioning. And I think that's the tricky part, is that it's all in the communication, right? Everything in this game is in communication, and people hate to see themselves as sales guys in dentistry, I think. But the reality is you do marketing, you do sales. I mean, the key is you do it ethically, of course, because once you really get good at this, you can sell something to anyone, but it comes back to you to do it professionally, ethically, etc. But for those of people who are really struggling, let's go back to the cosmetic dentistry thing. What's your advice, especially the communication side? What have been some really killer courses you think, or, again, if you could go back to yourself 20 years ago, you just graduated and you know everything you know now. When you go back, what are some of the things you would say avoid now that you know what you know? And what are some of the things that you would say, this is killer, you should do this, it will accelerate your career?
I think you need to be educated. You need to have a good baseline of how to manage cases. I think the mistake sometimes that we make is that we feel like we've got to go and spend thousands and thousands of thousands to take these complicated continuums and go to so many courses when the reality is, yes, it's important to do that, but all you really need is a good basic course to understand the basics. And then once you have those, find a good mentor, and then I think the key is understanding how to talk about these procedures so you don't have to sell patients. So here's my thing in my practice. I don't ever want to feel like I'm trying to upsell a patient on something. But how do you get more people enrolled if you're not talking about it? The only way to get more people enrolled is to actually have a menu of services. So in my practice, and I recommend that everybody listening to this right now, if you walk away with nothing else, you should absolutely do this in your practice. Sit down and come up with, if we're talking cosmetic dentistry, 3 ways to enhance your smile using cosmetic dentistry. So my practice, I tell everybody, I believe everyone deserves to smile with confidence. And so there's 3 different ways that we can work together. We can keep your own natural teeth and shape your enamel and shape the gums and create symmetry and whiten things. That's the most cost-effective option. It's going to be anywhere from $1,000 to $2,000 to do all of that. And I think doctors miss out on that you've got hundreds of those patients potentially in your practice or hometown that would be willing to do that. They don't even know that it's an option.
Yeah.
And this doesn't, you're not selling enamelplasty and gingivectomy. You're selling the smile shape procedure. And it's a combination of these 3 things. And then you have your mid-tier product, which is a composite veneer or Neer printed veneer. And then you have porcelain, but you have that on your website. You have it in your hygiene rooms. You have it in your waiting room of the 3 different smile services that we offer here. Just let your patients know what's possible. and let them come to you when they're interested.
That's fascinating, man. I love the 3-tier approach, but more importantly, something that I take away, and you see this here and there, but we don't really take it in, is giving it like a name or a brand or a title. And some people may think this is cheesy, but look, it's a lot more effective than just having a model of veneers on your desk and just talking about them and, oh, we could do this. If you actually give it, this is how people buy stuff. We buy products day in, day out. This is what people do. This is how every business operates. And I love that, how you've kind of formulated it. And nowadays with ChatGPT, this is so freaking easy. You don't even need to think these days. You could just put it into ChatGPT. Hey, I heard this podcast and Dr. Brian Harris said I should do this. This is what I offer my practice. Give me 3 tiers of things that I could offer and give them a nice name, and it will do it in 10 seconds.
I've seen some doctors go on social media and make fun of other doctors for doing this. And I just laugh when I see that, because I'm like, hey, this is just like basic marketing 101. And it doesn't have to be some crazy fancy name. Mine are very simple, but you could choose like reshape, refresh, and rehabilitation. It doesn't have to be anything crazy, but just help people understand the 3 different ways to work with you. You see it everywhere. You see it if you're going to go to a spa and have any procedure done, you have a menu list of items of the things that can be done. I just think it's a total cheat code for dentists, and we don't do it. But yeah, you're right. When you said that, I'm like, with chat especially, you don't even have to do the work now. You just type it in and you're like, oh, I don't love that. Give me some more options. And eventually you'll find something that just works.
And you just think about, look, we're all different personalities. We know from our colleagues, our friends, dental school, if you think back to it, we're all different personalities in dentistry. We're all type A's, but you just have to figure out something that resonates with you. And what I really love about this approach, because I'm thinking about it, I kind of do this without giving it a label. And now I wanted to give it a label. I had a consult just yesterday when I was in the clinic, and a patient came in. They had no teeth, completely edentulous. It's relatively normal here in New Zealand when you work with the middle or low class. And they were like, I want, teeth replacement. And automatically, I just in my head got a piece of paper out and put 3 lines in, so split it by 3 and told them it's basically denture, hybrid, or all on X. And so in a way, I just did kind of what you're talking about, Dr. Brian. I just haven't really formulated it and made it consistent. And what I think is really important is when you do it that way, it also focuses you. I think for a lot of people, when they talk about cosmetics, they get too all over the show. They try to talk about, oh, we can bleach first and do this first and this first and this first. If you are talking more than the patient, you've confused the patient in my books. And I love that approach. It's just really simple. People can get it. 1, 2, 3. Which one do you want? And I guess your job is just to explain them if they have questions.
And what you'll be surprised is how many people choose the top tier when maybe you wouldn't have sold it that way otherwise. Listen, I think a great analogy is like they do it with cars. So like, I think Porsche is a great example. You can go in and buy a Boxster. Yeah. You can buy a 911, or you can buy a GT3 RS. And the crazy thing is, all 3 of them are Porsches. You're never going to have somebody going in to buy a GT3 RS that would ever buy a Boxster, and vice versa. It's just people can come in and work with Porsche and get exactly what they want and feel great about it. But could you imagine going in, and if there wasn't this level of, and having them be like, well, you can get racing suspension, you can get the touring package. You wouldn't even know where to start. But if you simplify it and say, hey, if you're for the enthusiasts, if you want the best of the best, yeah, just get this. If you want practical and still look good, get this. And yeah, I think 3 is the magic number. You start going 4 to 5, it's too complicated, but it's like snap in, overdenture, all on 4 acrylic or all on 4 zirconia, and just make that your 3, or however you want to do it. But keep it simple, give them options.
Yeah, that's epic, man. And for those listening, now that you'll be walking around with this in your mind, hopefully, or maybe you are already on the jog or you're driving to work or whatever, you're going to see it all around you. A lot of businesses do this. It's always 3 options. You will see it everywhere. They always have the 3 options. They always give it a special name. And I think it's something we don't do enough in dentistry. I'm curious. So what's, if you reflect on your consults, what's some of the most common FAQs? Things that you're already prepared. Most patients ask these questions. what typically comes up? I imagine from my own reflections with patients is, well, costs you've already sorted out. I don't know if you talk about longevity, but the common things I get asked is longevity, etc. And I think that's also another element that dentists need to be super confident talking about. And it's hard when you haven't done a lot of cosmetic dentistry, you actually don't know. And then you kind of and ah, and if you're umming and ahhing, then you lost confidence. And then it's you have to be really slick with your communication. But what's some of the things that you've always come across that patients ask?
Yeah, longevity is one. And I'll give you the exact verbiage I use, and it works. I for longevity, if they ask, I say, hey, listen, what would be awesome is if we did this and it lasts you for the rest of your life. Like, that's possible. And the materials we use are great. The reality though is, if you're going to do this, expect that you're going to have to at least get it redone sometime in your life. And so 15 years would be great. If we go 20 years in porcelain, that would make me really happy. So just know, like, once we do this, there will be upkeep down the road. And part of that is just going to depend on how you take care of it. And so here in my practice, I want all of my patients, if they're going to make this investment with me, I want them to know that I'm going to be invested in them. And so in that first 5 years, if anything happens, as long as you're current with your cleanings, like, no stress, I'll come in, we'll take care of it. There's no cost to you. And then after that, as things come up, then you can pay. But usually it's one thing here or there. So I think just going in really direct and being, the key is just be honest. Could they last their lifetime? They could. I had my first set of veneers 22 years, never had a single issue. And that was with Empress, which is a third as strong as my current veneers. And they could have gone, many, many years without any issues. But the reality is, most time it's 15 to 20. And if anything happens in the first 5, like, I got you covered. I just think people want to hear the truth. And I think if you come in and it's all like rainbows and butterflies and everything's great, like, they can see through that.
100%. What other things? So longevity is one. What's other common things if there is? I don't want to put you on.
Yeah. Is there any downsides to doing this? Yeah, there's, with any procedure, there's always potential complications. We believe that if we design things right, it minimizes those chances. But some of the things that could happen is, as we're making things look better, we're also potentially changing the bite. And that might mean a couple of visits after we finish to get things balanced back up again. I always tell them I say the biggest things that usually come up, if there's going to be complications, it's for not communicating enough about what it is that you want.
Yeah.
And so let's just make sure as we work together, like, I give you permission, be as picky as you want to be. And if you're out of lines, if you're asking for something that's just not possible, I'll be super honest and I'll tell you, like, it's not possible to do that, or I don't think it's a good idea to do that. But I want you to just, like, if you see something, speak up and we'll talk about it. So it's like I give them permission to be super picky, but then you notice I also will say right away, if what you're asking for isn't reasonable, I'll be really honest myself and I'll tell you that.
That's epic, man. Look, I'm mindful of your time, my friend. I could speak to you for another hour or two easily. But you have been very generous with your time, Dr. Brian. I really do appreciate it. You're a super busy guy running an extremely successful practice or group of practices, and your lab and working with Neer, etc. And it's really amazing what you do. It's inspiring. So for those of you who haven't heard of Dr. Brian, I highly recommend going on his Instagram, check out his cases. But Dr. Brian, to wrap this up, what's your kind of last kind of message for the listeners out there? Any pearls of advice or pearls of wisdom or anything that you just want to wrap up this episode with?
Yeah, 100%. I was fortunate enough a few months back to give a talk on a TEDx stage, a TED Talk, and the topic of the talk is this idea of connection before conversion. And so my advice would be, regardless of what you're doing within dentistry, like, if you can just, like, drop the sales process and really focus on the buyer's process and what it is that your patients want, I think that's the key to success. Stop trying to sell people into things and really think about, what do they want? Well, most people want to know, what are my options? can I trust you and what's it going to cost? And the faster you answer those questions, the faster it builds trust and people are going to want to work with you. But if you think in the world we live in now that someone's going to come in and just because you're a doctor, you're going to tell them what they need to do and they're going to do it, that world is long gone. Like now it's all about like who can build connection first.
Yeah.
And I'll tell you, I do a lot of smile cases and I'm not the best cosmetic dentist. It's the only thing I do every single day. And people fly from all over. They fly over some of the best cosmetic dentists in the world to see me to get a product that maybe isn't even as good as what they would have gotten seeing somebody else. And they do it because they know that I'm going to take great care of them and I'm going to give them something that they're super happy with. And so I would say connection before conversion, always.
That's an incredible way to wrap up this podcast. Thank you so much, Dr. Brian. I don't need to say anymore. I think you've absolutely smashed it out of the park. Once again, I really appreciate your time. I really appreciate how generous you've been with your wisdom and even just sharing to everyone out there your processes. It's not an easy thing to do, and I thank you deeply for all of that. I'm sure the listeners will get a lot from this episode. So once again, a big thanks to Dr. Brian for joining us here on the Digital Dentistry Decoded podcast. Those of you who are listening, like, comment, subscribe, go support Dr. Brian, reach out to him on Instagram, and I will see you in the next episode. Of course, share it with your friends as well. That helps us out a lot. See you guys.